and welcome to your cranial nerve examination. My name is Dr. Murmurs, and I will be performing your examination today. We will be testing all 12 of your cranial nerves using a variety of procedures and techniques. These procedures are designed to be both relaxing and stimulating. You should not experience any discomfort. You may leave this process at any given time. To begin, we're going to first of all take some of your vital signs. We just need to ensure that you are a healthy individual. We will be taking your heart rate and also a sample of blood for our labs. Please sit back and relax. I would encourage you now to remove your socks and shoes and any outerwear. Please provide these garments into the basket provided beside you. Okay. Please just relax. All seems well there. I'm just going to listen to your lungs at the back of you. Breathe in and out, and breathe in and out. All is well there. Okay, now I'm just going to take a little sample for our labs. I'm just going to remove a syringe from its packaging. Okay. Please may I have your left arm? Thank you. Sharp scratch. Perfect. Hold still. Okay, would you take my hand off? Please put your hand on there. Just apply pressure to the wound. Thank you. Okay. Just going to package that up now. Be sent to our lab. Okay. Has it stopped bleeding? Let's see. Now we're going to move on to our cranial nerve procedures. To begin with, we're going to go to the olfactory nerve. The olfactory nerve is known as cranial nerve number 1, and it is testing your smell. So, I have a lime and a peeler. I'm going to peel some of this lime and I'm going to hold it under your nose. You are going to tell me whether you can smell the lime. Okay. Can you smell? Yes. It's very strong. Okay. Now we're going to examine the optic nerve. This is the nerve that provides you with sight. Now we're going to test this in several different ways. First test is acuity. Acuity is tested with the Snellian chart behind me. Please, can you read the chart? Okay. This one. Can't see it. That's okay. We'll say your vision is 20/25. Still great. Now we will move on to your visual fields. You need to look directly at me whilst I wiggle one of my fingers in each one of the 4 quadrants. 1, 2, 3, and 4. Please, can you identify exactly which finger is moving? You'll see how it works. I'll put my hands like this, and you need to tell me what finger is moving. Okay? Okay. Excellent. Now, we're going to do visual reflexes. I'm going to place one hand vertically along your nose to block any light entering the eye, which is not being tested. I'm going to shine a pen torch into that eye and check your pupils on both sides. I'm looking to see whether they constrict. Okay. Then I'm going to look at both eyes using fundoscopy. Okay, hold still. Alright. Now we're going to look at the oculomotor nerve. This is cranial nerve number 3. We are also going to look at the trochlear nerve, cranial number 4, and the abducens nerve, cranial number 5. These are all involved in the movements of the eye. Please may you keep your head perfectly still and directly in front of me. Okay, I'm going to move my fingers like this, up and down like so, but slower. You need to follow my finger. Okay. Alright. Now, the trigeminal nerve, cranial number 5, is involved in sensory supply to the face and motor supply to the muscles of mastication. There are 3 sensory branches of the trigeminal nerve: ophthalmic, maxillary, and mandibular. I'm going to be testing the sensory branches by lightly touching your face with a brush, followed by a blunt pin in 3 places on each side of the face. Okay, we're going to start with around your jawline. Now for your cheek. Okay, and now for your forehead. Alright. The corneal reflex will now be examined, as the sensory supply to the cornea is also from this nerve. I'm going to touch the cornea with the side of my brush, very, very lightly. You should then you reacted just how you were meant to. Now, to test the motor supply, I need you to clench your teeth together, observing and feeling the bulk of the masseter and temporalis muscles. So I will be gently feeling those muscles whilst you do so. So please close your mouth. Okay, clench your teeth, please. Now try and open against the resistance of my hand on your jaw. Okay. And now I need to perform a jaw jerk on you. I'm going to place my left index finger on your chin and I'm going to strike it with a heavy object. Great. Okay. So, as the abducent nerve is also tested in this manner, we can skip past that one just now. Now for the facial nerve. The facial nerve supplies the motor branches to the muscles and facial expression. This nerve is tested by me asking you to crease your forehead, raise your eyebrows, close your eyes and keep them closed against resistance. I'm also going to ask you to puff out your cheeks to reveal your teeth. So crease up your forehead. That's it. Okay, now I'm going to put my hand and I'm going to put it onto your face like this. I want you to try and keep your eyes closed against it because I'm going to try and pull them apart. Okay, now can you puff out your cheeks up? That's it. Now strip back to reveal your teeth. That's it. That's fine. Now, the vestibulocochlear nerve provides innervation to the hearing apparatus of the ear and can be used to differentiate conductive and sensory neural hearing loss using the Rhine and Weber tests. To carry out the Rhine test, I will be placing a tuning fork on your mastoid process and then next to the ear, and I will ask you what's louder. Okay, ready? Okay, next to the ear. What's louder? Okay, other side. Mastoid process. Now next to your ear. What's louder? Okay. Mastoid process. Next to your ear. What's louder? Okay. Mastoid process. Next to your ear. What's louder? Alright. Now, to do the Weber's test, I'm going to place the tuning fork face down in the centre of your forehead. Then I'm going to ask if it's louder in either ear. Okay. And driller. What's louder? Okay, I'll try again. What's louder? Okay, one more time. What's louder? That's correct. They do sound the same. That's the right answer. Okay. Now, we are going to look at the glossopharyngeal nerve. It provides sensory supply to the palate. I'm going to test with a gag reflex. You're not going to like it, but it should not provide you any discomfort. I'm going to use this tool here. I will need you to stick out your tongue. That's it, open wide. Okay, try again. Open your mouth wide, stick out your tongue. Okay. Now, the vagus nerve provides motor supply to the pharynx. I need you to repeat some words after me so that I can see the efficacy of the muscles of speech. I need to also observe your uvula before and during the word ah. So we're going to start with that first. Open your mouth wide. Say ah. Okay, try again. Say ah. And one more time. Okay, now repeat these words after me. Ball, sock, teeth, tomato, children, picture, letter, hairbrush, bank, skittle, hairspray, perfume, tomorrow, animal, lion, giraffe, popcorn, aftershave, gloves. Okay, excellent. So, now, for the accessory nerve gives innervation to the sternocleidomastoid muscle and the trapezius muscles. Your sternocleidomastoid muscle comes across your neck like so. Now, I need you to shrug your shoulders, and I need to turn your head against resistance. Okay, please shrug your shoulders for me. I'm going to put pressure down. Push against it. Okay, now try and turn your head that way. Keep trying. Another way. And this way again. And the other way. Excellent. The last nerve we're going to look at is the hypoglossal nerve. It provides motor supply to the muscles of the tongue. Now, I need to look at your tongue, and I need you to go and roll it like so. Please stick out your tongue. Now try to roll it. It doesn't mean anything, you're just not a tongue roller. I just need to look at the grooves in your tongue. Stick it out straight for me, don't let it loll to any side. Excellent. You can pop your tongue back into your mouth. Okay, well, the good news is that you managed to pass all of your tests with flying colours. You performed well in every single procedure. Therefore, I do not believe you have anything wrong with your cranial nerves. Of course, if that does change, for example, there becomes issues with your eyes, perhaps even your muscles weaken, maybe your neck or your shoulder, what we just tested there. If anything was to change, then you just let me know and we can go through this again. It was a pleasure to meet you, and I hope you found this experience both relaxing and stimulating as promised. I'm sure we'll see you again in the near future. Bye for now.